Today, Dr. Marissa Grant-Tate, the island's only female oncologist, is here to educate us on the things surrounding breast cancer. And that's quite a feat, Dr. Tate. But thank you for joining us.
Thank you for having me. Good morning.
I do want to state the obvious, which is, of course,
pink hair.
Yes.
I love it.
Thank you. Thank
I
you.
can anticipate why you did that, but why don't you let us know in your own words?
Well, I would say more so as suppose what is a symbol of encouragement to my patients. Obviously, breast cancer is never an easy diagnosis, as you know, with just about any other cancer. But particularly when you have to deal with breast cancer, what you find is that it really has such a tremendous impact on a woman's life. Again, because of the fact that one, you're dealing with a cancer, but then two, at the same time, the breast is very well known as, you know, an organ that, you know, women usually associate their femininity with. Yeah. And so then, you know, having to have that altered, it drastically impacts on their life.
I can't help but think when you speak to the alteration, the first thing that pops up in my mind is mastectomy.
Right.
We've been through cases where we've seen, I think Angelina Jolie it was, yes, who had a double mastectomy, right, the first sign of that. That's not generally the case for a lot of women who are suffering from breast cancer, is it?
Correct. To be quite honest, as it would pertain to the mastectomy on a whole, there are different types of mastectomies. What most of us are familiar with would be the radical mastectomy, where the entire thing is removed. And to be quite honest, it is not the only form of treatment as it would relate to the surgical form of management. And that is also one of the things that I try to ensure that women are aware of when they are making what would be the necessary decisions. There will be times where you will, in fact, have to have the entire breast removed. But always, I would say at first, you know, to get all of the necessary information, have a discussion with your surgeon, try and get your oncologist involved first, perhaps even before what would be the surgical procedure, in terms of being able to know what your different avenues, your different options are. As it would pertain specifically to Angelina Jolie, though, what she would have had would have been more along the lines of a prophylactic management to be able to, I guess we can say, preempt what would be the risk of cancer based on what would have been her family history of breast cancer. No, it is not something that is practiced, and to be quite honest, it's still very, we really can't say that it's quite effective, you know, in terms of, you know, what she would have had done. And so then, I, as an oncologist, it's not something that I would recommend that women just go out and get done. There are, in fact, many other ways that you can prevent breast cancer in terms of the risk, reducing the risk, other than having both of your breasts removed.
So for those of us who are not aware of what breast cancer is, can you give us a brief description, and can you also tell us, is there anything in particular that causes it?
Well, in terms of, I wonder which I should answer first, the cause or in terms of what it is. Breast cancer is simply to say that you have, you know, a transformation of the cells in the breast, specifically of the breast tissue. As we know, the breast, you know, it's made up of many different structures, so not only breast tissue, but the breast cancer is when you have a change in the cells of the breast, and that allows it to then be able to spread to other parts of the body. And that is really where, you know, the trouble actually comes in. In terms of actual causes, there are only two known specific causes of breast cancer, and those would be what we would refer to as external ionizing rays or radiation. So women, for example, who may have undergone radiation, perhaps for another reason, that is a direct cause of breast cancer. And the second known cause of breast cancer would be the supplementation of estrogens. So women who ingest estrogens. And usually this was a greater problem years ago, where patients for menopause would have been prescribed estrogens to be able to palliate the symptoms of menopause. And so, as of course, you know, with everything else, with the knowledge that has been acquired, then this practice has been decreased significantly. And so then we've been seeing less of these particular types of cases. Everything else would be risk factors. If if you want me to tell you about the risk factors,
Yes.
but we'll probably be here all day. But the risk factors are different to the known causes, and simply being that when we speak of risk factor, what we are in fact referring to are the things that can increase the likelihood of you getting breast cancer, but on their own, and even though they may be multiple, it is not a specific and direct fact that you will in fact develop breast cancer.
All right, so you spoke to some things that could be done to reduce the risks of breast cancer. Can you tell us more about those things?
Well, in terms of reducing, I would point to, obviously the first fact would be diet as much as possible. There are some factors that we simply cannot alter. Perhaps I should touch on those first, which increase our risk for breast cancer. And so then just being a woman, for example, that increases our risk for breast cancer, right? Yeah, I know, right? And so then we actually point out and say that, for every male that has breast cancer, you will have 200 women who will be diagnosed with breast cancer. At one point, we counted it as 100, and then it went up to 150 per male in about 2016, and then by the end of the year, then it was updated to 200 women for every male who would be diagnosed with breast cancer. We also have to look at the age factor, as that is pretty significant. So aging women, particularly women who are around what would be perimenopausal periods, so not yet quite menopausal. That is actually where you have one of the highest incidences in terms of breast cancer. And then we have the postmenopausal women who have the highest or second highest or equally high risk of breast cancer. And then we point out and say that only 3% of women before the age of 30 would develop breast cancer. And so then if I were to go back the other way around and, point out in terms of the factors that can assist in terms of decreasing the breast cancer, we want to point out, what would be a fit weight, for example. Obesity is one of the factors that significantly affects that in terms of the things that we can change. And so then diet is important, in terms of ensuring that we're not obese, simply because of the fact that the body then uses cholesterol to be able to then make what would be the sex hormones that contribute to breast cancer. Women who have their children at much younger ages, that too also decreases the risk. A woman who would have had her child, her first full-term pregnancy rather, before the age of 20, she has what is going to be a 50% reduced risk compared to the general population. And in terms of the risk for the general population, as you can see, I like my statistics. In terms of the risk for the general population, 1 out of every 8 of us as women will be diagnosed with breast cancer. As I said, if I were to, delve into what would be, risk factors and even those in terms of reduction and so forth, we'd probably be here all day. So.
What are the stages of breast cancer categorized?
In terms of stages, as what most people would familiarize themselves with, we say 1 to 4, stages 1 to 4. But if I were to group them, a bit more, then we would refer to what we call the earliest in terms of early stage disease, which is to say that the breast cancer is still located within the tissue of the breast. And only in the tissue of the breast. We then have what we would refer to as locally advanced disease, where it would have spread from the breast, to the nodes, as we would refer to them as, basically then preparing itself to be able to then propagate or spread to what would be the other parts of the body, which is where we would now consider that we have metastatic disease or advanced disease, which is typically what most people, are most fearful of, because then that is what we would categorize as a stage 4.
Curious to know what you can tell us about there being early signs of breast cancer.
Right. So in terms of looking for early signs of breast cancer, you don't want to wait for what would be signs, because I would say, when we hear of signs, we're probably waiting, for something to happen or see if something actually occurs. And if we're waiting for that, then that can be a problem. So what we instead emphasize upon when it comes to breast cancer in terms of early detection would be the auto examination of the breast. And so then a woman is encouraged to check her breast once a month, every month. We would say preferably about 5 days, at most a week after she would have had her menstruation, because then at that time, then the tissue of the breast, it is much more relaxed, much more smooth, and you're less likely to be able to confuse what might have been a lump as a result of the menstruation, right, with something that is in fact pathological. And so then we say that the lump is the first sign, so you have to go looking for it. One of the things that I would like to dispel is the fact that many of us as women, we kind of sit and assume that not me, right? So we think of breast cancers with everybody else, and not necessarily ourselves. And this is perhaps one of the things that prevents us as women from actually checking our breast. And again, it is something that most of us as women, or a very large percentage of us as women, will in fact experience at some point in time, and hence the need for us to emphasize on what is that monthly breast examination. The mammograms, that is another great resource, but the mammogram should be practiced once a year, and this would be for women that would be over the age of 40. If you have a family history in terms of breast cancer, and particularly at what would have been an earlier age, then you want to emphasize on what would be an ultrasound if you are not yet 40, of the breast, and of course to the monthly breast examination. Most women, in fact, about 70% of women, they find the lump themselves. And so then, you're not waiting for a doctor to come and say you have late stage disease. You find it early so that it can be addressed early.
All right, given what you've told us so far concerning the percentage of men that would be likely to develop breast cancer, are some of these tips applicable to men as well?
Well, we encourage the men to do much of the same in terms of what would be the breast examination, but again, obviously because of what is the ratio, for the year of 2020, for example, worldwide, there were over 2.2 million cases, new cases of breast cancer that were diagnosed, and men, that was within females, and then men, only accounted for what was 1%. So yes, we encourage the men to check, particularly if there is a family history of breast cancer, and particularly at what would have been a relatively young age. But there is not the same sense of urgency in terms of screening and precaution when it comes to men, simply because, again, it is an illness that is associated with estrogen. Estrogen is the enemy here.
They should be good.
Right.
It's the enemy.
Lucky them, huh?
Lucky them indeed. So my burning question, what led you to this particular field of oncology?
To be quite honest, I would say that, once I would have returned from having studied medicine in Cuba, of which I am so proud. Thank you. And so I would have graduated from general medicine in 2005. And I covered, I worked principally in the emergency room, at the accident and emergency room at the JNF for about 10 years. But then I also, covered quite a few other services at different intervals and so forth. And what was clear was the fact that there was a void. There was a clear void. And I, in particular, I honestly grew weary of, having patients that would come to the emergency room with different stages of different types of cancers, and only be able to try and offer them perhaps what might have been some sort of pain relief. And, usually not even that would work. And, there was a clear void, and I just felt that, someone needed to take upon the challenge. And so that I did.
I'm actually glad that you did.
Thank you.
You can feel comfortable being at home.
Thank you. Thank you.
You're welcome.
All right. In closing, Dr. Tate, and that really went very quickly, I have to say. Where can persons go to get screened for breast cancer?
Well, again, emphasis on self-examination, emphasis. And I can't say that, enough times, because, again, obviously, When we think of screening, we think of, all of these wonderful and, expensive tests that for one reason or another are usually out of reach, for most women. And so emphasis again on what is the auto-examination of the breast or self-examination of the breast monthly. If it is that you find something, and again, that's one of the reasons why you're encouraged to do it every month, because then you familiarize yourself with what is there and what should not be there. And so then if there's a change, you're able to pick up on that. If you find something that concerns you, then you can go to your private physician, or you can go, to your community center, health center. What I would say though is that always insist that it be checked out. Okay, so at no point should you leave your doctor's office and you're told it's nothing to worry about, and then you just go about your merry business. Okay, insist whether it be that you get an ultrasound, insist whether it is that you get a mammogram, and then based on those findings, you would be able to get a biopsy. I myself in particular, I do quite obviously a bit of breast examinations and so forth, in terms of being able to assist women to getting to what would be the necessary diagnosis and treatment that may be necessary.